This episode of Hand to Hold's NICU Now podcast is sponsored by Prolacta Bioscience, the pioneer in providing 100% donor milk-based nutrition for premature infants in the NICU. Only Prolacta offers a human milk fortifier made exclusively from 100% donor milk. For more information, visit prolacta.com. Hello, my name is Kelly Kelly. Welcome to the NICU Now audio support series. I am a NICU parent to Jackson, a micro-preemie born at 24 weeks, and Lauren, a late-term preemie born at 34 weeks. I am also the founder and executive director of Hand to Hold, a national nonprofit dedicated to providing education, resources, and peer-to-peer support to families that have experienced premature birth, the loss of a baby, or have a child with a special healthcare need. Hand to Hold's NICU Now audio support series was developed to help NICU parents navigate their NICU journey. Just 8 hours after my emergency C-section at 3 in the morning, a nurse came to take me to see my son for the first time. I did not want to go. I did not think I could handle seeing him hooked up to monitors and machines, but my mom encouraged me to go. She told me how important it was for my baby to hear my voice. I was wheeled down a long hall and we passed the newborn nursery. I remember seeing those fat, screaming, healthy babies and turning my head away because I had to choke back tears. I knew that was no longer our reality. Our reality was behind a locked door in a secluded part of the hospital that many people never see. The nurse showed me how to scrub in, and I was taken to Jackson's open crib. And there, lying naked under a piece of plastic wrap, was my baby. He wore a tiny newborn sleeping cap that engulfed his head. His eyes were still fused shut. A respirator tube was taped to his mouth. I could barely see his face. His skin was translucent, and I could see every vein in his body. He had IVs in both hands and an arterial line in his belly button. And with each breath, his tiny chest heaved up and down. As the doctor shared with me and my husband the tremendous challenges our baby faced, I was overcome with emotion. I felt sick and faint, and I just desperately wanted to return to my room. Until I read Casey Matthews' memoir, Preemie, Lessons in Love, Life, and Motherhood many years later, I felt tremendous guilt for my resistance to visit my baby and my lack of the natural mother instincts to protect and fight for my medically fragile child. With raw honesty, Casey shares about the fears, challenges, and emotional toll of the journey of a NICU parent. Like me, she strongly resisted visiting her micro-preemie in the NICU for the first time. She also struggled to feel a bond with her daughter, Andy. I wanted to take just a minute to read from Casey's book because I think many NICU parents may have experienced similar emotions after a traumatic birth experience. Casey writes, "For 2 days, my husband Lee continued to go back and forth to the NICU alone. He left Polaroids of Andy on my bedside table. I covered them with a box of tissues. On Wednesday morning, he was about to walk out the door when he turned and he looked back at me. His eyes were red from lack of sleep and his hair was sticking up in every which way. 'You've got to see her at some point,' he said, and then he walked out. 15 minutes passed before I moved the box of tissues and picked up the Polaroids. It was hard to see her beneath all the tubes and wires, but when I held the photos at arm's length, I saw she was more human-like than I had thought. I ran my finger over her tiny fingers, her closed mouth. Her eyes were like the eyes of a baby robin I'd discovered as a girl in a fallen nest. Everything was there, just miniaturized. When I looked up from the photos, Lee was standing in the doorway. I had a vision, I told him. I saw 2 paths. One leads to a funeral in a week, the other to a beautiful 5-year-old girl. He stood still watching me. 'I'm going for the latter,' I said. Relief flooded his face, and my journey as a NICU mom had begun. I think a lot of parents have a similar experience to Casey's. We struggle to see past the tubes and wires to see our babies. The medical equipment presents a physical and psychological barrier between us. I was there at the bedside, I was scrolling through the motions, but I put up an invisible wall to protect my heart. Dr. Michael Heineman, NICU parent and professor emeritus of clinical psychology at the University of Wisconsin-Milwaukee and member of the board of directors of the National Perinatal Association, calls this protective wall anticipatory grief. It happens when we prepare ourselves emotionally for the possibility of our baby's death. Joining us today is licensed marriage and family therapist Kara Wallen, mother of twin boys William and Elliot, born at just 26 weeks gestation. With the loss of her son William and lengthy hospitalization of Elliot, Kara knows firsthand the emotional roller coaster a NICU parent can experience following a traumatic birth. Welcome, Kara.
Hey, Kelly.
Kara, did you experience anticipatory grief and challenges bonding with your boys when they were born so early and sick? Is this common for NICU parents?
Sure. I think that this is something that basically most NICU parents have to cope with because the experience of being in the ICU is so disorienting and so terrifying that it's reasonable that our brain organizes around trying to protect ourselves from whatever could potentially happen in that circumstance.
So even for a late-term preemie, a parent could experience this anticipatory grief.
Yeah, basically one of the components of trauma and the reason that traumatic memories stay with us for so long is that they bring about with them the threat of death. And when our mind is exposed to the threat of demise, it knows that it's very important to remember that because it's so high stakes. So when a parent is faced with something like the potential death of their child, of course, we're going to prepare for every possible outcome to the best of our ability because we're going to be desperate to feel any kind of control that we can over a situation that is pretty much completely out of our control. So it's sort of the way that the human mind works. So I would say that possibly in some cases people don't have that same experience, but I would say more likely than not, in most, people have this experience.
Well, I know, like I said, I felt a lot of guilt. I felt guilt because I didn't feel the automatic bond. So can you help us understand what are some normal reactions? What are some normal emotions? What would you expect a parent in this experience, in this, NICU environment after a traumatic birth? What are some of the emotions that you find that are common in NICU parents?
Sure. I mean, guilt and shame is something that I think is really important to notice and give attention to in speaking about it because it is so common to anyone who's gone through any kind of a traumatic experience. You will be able to find these feelings amongst people who were doing military service and they were in a situation where obviously things were out of control, but they feel if they did something differently, they would have been able to protect their buddy from getting hurt. You find it in situations where people have been assaulted. Why was I wearing that dress? I must have been attracting this perpetrator to me. And again, you find it in NICU parents. And I remember one of the most important things that one of the team at our children's hospital talked to me about. It was a neonatologist. He pulled my husband and I into his office one day and he just told us, you will be blaming yourselves. He's like, you will be thinking, oh, I did this or that the other day, or maybe 2 weeks ago when we did this, or we were too stressed out or whatnot. He said, believe me, if there was something that you could put a finger on that caused preterm labor, I would be happily unemployed. But in reality, we don't know what causes it, and that's why we work so hard to try and prevent it now. It's not your fault. And it was really empowering to hear that from someone who was in the medical field that had a lot of experience with it, because that feeling of guilt and shame can be so prevalent. And it's as if in your logical mind, there's nothing that you could have done. But at the same time, in your emotional mind, I remember just going through everything. I had lifted a chair at my work the day before and I thought, oh, that was it. There we go. Or, why did we move? That's too stressful of a thing to do when we're pregnant.
So guilt over causing the preterm birth may also transfer over into my guilt and shame of not feeling a bond right away. Because you're blaming yourself that this happened. I don't want to attach to this child that may die.
Sure.
I see it differently now. I don't think I've ever thought about it in that perspective because of course I was searching for the why. It was, did I eat fish? Was it because I was cleaning yesterday? I think we all search for the why. And I think statistically we know that in more than 50% of the cases, there is no why. We don't know why. It's a spontaneous delivery. And so I think it's so important for us to talk openly about how we're feeling and seek support and be honest about these emotions that we're having and challenges that we're having, feeling that bond and how we process this guilt and shame.
Absolutely. And I think another thing that you might have touched on here is that we feel grief, not just the anticipatory grief, but we feel grief for the idea that we had of how things would have been. And so even though things turn, the course has changed, you're on a different path, and you're going through the NICU journey, I think there's also grief for the ideas that we held of what we thought our birth would look like. You know, a full-term delivery, being able to have a birth plan, you know, that's something that a lot of people hold very dearly. People sometimes even feel guilty for feeling grief for it because they feel like, oh, well, that's ridiculous because now we're in a life and death circumstance. But it's reasonable to feel grief for all of these things. And going through that grief and not having a lot of space to do that can be really challenging. So it's something to be aware of. And it's something that's difficult to cope with and can bring with it a lot of sadness, a lot of anguish, and a lot of pain.
Well, like I said in my opening, I didn't know other parents felt that way. And so I think I carried around a lot of guilt and shame because I never voiced it. I never talked about it. Sometimes think of myself as kind of a caricature or what you might call my representative, because I was sending in a very different person into the NICU every day. That wasn't really how I felt, but I felt like I had to have this persona of not only for my husband and the nursing staff, but almost like fake it till you make it, that I had to be this great mom. I think to an outsider, it would appear that I was very bonded, that I was very integrated, that I was doing everything because I was there. I was at his bedside. I was going through the motions, but I was numb. I was completely numb. And so that invisible wall, that barrier was there. But to the outsider, I don't think they would have seen that. And I think I did myself a lot of detriment by pretending and not being honest about my feelings. And so I can't tell you the emotions when I read Casey's book for the first time. It almost felt validating. And there was this wave of forgiveness that, hey, you're not the only one that felt that way.
Yes.
And maybe this is normal. Maybe other NICU parents feel this way too. You're not a bad person. Because I did. I felt like a bad mom. I didn't feel like a mom. I felt like, not only did I not feel like a mom, I felt like a bad mom. Because I should be, fighting for this baby, and I should feel this automatic bond to him that just was missing.
There's a lot of healing in finding community and realizing that you're not isolated and that your experience is something that is commonly felt amongst others going through similar circumstances, and holding on to that sense of self-forgiveness. And if you can't forgive yourself, if you can't find that, because sometimes that's just too difficult when you're in the moment, it really helps to be able to even just hear those stories from other individuals who have been through something even mildly similar to what you're currently going through, so that you don't feel as if you're doing something that's somehow wrong. Finding a place to be able to speak to your experience is incredibly valuable, but sometimes it's almost asking too much of yourself when you're dealing with a traumatic circumstance, because essentially the NICU experience, regardless of how it results emotionally for you, is an acute traumatic experience.
One of my clear memories was leaving the hospital for the first time. No one prepared me for that. Jackson had surgery that day, so they did not discharge me until after his surgery that day, so that I'd have a place to be while he was having his surgery. And I was so concentrated on that I didn't think about the fact that, we were checking out that day. When they wheeled me down in my wheelchair and they parked me there and my husband went to get the car, there was another mom there with her baby in her arms and the flowers and the balloons. And man, the grief and the shame I felt sitting there empty-handed, the weight just felt like it was going to crush me. And I just felt so unprepared for what that was going to feel like. When I have the opportunity to help other parents who've had a NICU experience, so if we can talk to them before they're being discharged to help them understand and process the emotions of being separated from their baby, even if they don't feel, like I said, I didn't feel bonded to him yet, but I also felt this extreme lack of control and guilt over leaving him there. I was supposed to be his mom. I was supposed to be protecting him. I'm supposed to be with him. And now separated by a good 30, 45-minute drive on any given day. So that, I think, those emotions of leaving the hospital should be acknowledged.
I think there's another piece of that emotional experience in leaving the hospital that can manifest in irritability, jealousy, and anger.
I was really angry at the nurse for bringing me down when another mom's sitting there, at that mom that she got the happy ending that I wanted.
Sure.
And then even more guilt because this should be a blessed time for her. Yet I felt angry at her for getting what I wanted.
Sure, absolutely. And, traumatic experiences, they have the effect of shutting down the way that we experience our moment-to-moment experience and going into this case scenario type of outcomes. And so when we're locked into that type of a preparation mode, oftentimes some of the emotions that we associate with like spontaneity and mindfulness and being happy, those get shut down from us because we're in this moment of being able to prepare for what the worst case scenario might look like. And so sometimes that results in just feeling irritable that everybody else gets to experience their life the way that they would like to. And that can be very jealousy provoking too.
The exhaustion exasperates that. I mean, I was so incredibly exhausted from the delivery and the pumping and all the decisions we had to make in those first few days and very, very little sleep. I think that just being completely exhausted exasperates all of those emotions.
Sure. And so does depression. Depression, one of the sort of unknown symptoms of depression, or one that's not talked about very often, is just irritability and finding yourself saying things that you would never, under ordinary circumstances, find yourself speaking like. But when you're in those moments, just being short with people or having a difficult time or finding it just impossible to listen to somebody complain about being too pregnant is a really common feeling too.
Well, I do think it's important for us to talk about how we process our emotions differently, husbands and wives. I wonder, for the dads, is there anticipatory grief as well? Do they feel the same bond? Because we've carried the baby in utero and we've been, most of us, reading our what to expect when we're expecting. Sometimes the fathers are very engaged, but sometimes not. So would it be normal for a dad to feel some anticipatory grief?
Yeah, absolutely. It's normal for fathers to feel that way too. With anything, of course, it's the individual's experience and the ways that we've coped with difficult things in the past often come to the forefront when we're faced with a trauma. So it's difficult to predict exactly or in general terms for everybody how they're going to be able to manage it. But I think it's absolutely common for dads to experience anticipatory grief as well. Basically, it's kind of trying to imagine with humans, what that feeling of a lack of control and utter lack of predictability, and what do you do to be able to survive day to day? Because that lack of predictability is basically killer to human survival and being able to feel comfortable in your own environment. And when you're in a situation that you have to advocate, in fathers' cases, both for the mother of the child and the child, him or herself, you have a lot on your shoulders in terms of responsibility. So I've seen with a lot of dads, too, that they almost dissociate from what's happening in the moment so that they can manage it. So they're the ones that are still going to work. They're the ones that are still paying the bills. They're driving the cars. They're talking to the doctors. They're advocating with the nurses. They're coordinating different services. And so they have a very different set of expectations placed on them immediately following the birth and then down the road as well.
I wanted to just reiterate that, infant attachment to the parent is a predictor of the child's later social and emotional development. So acknowledging that grief, acknowledging that these are normal emotions, and still finding ways to bond with the baby is so important because it has long-term impact on the infant for their social and emotional development. So we cannot downplay how important it is for us to get the support that we need.
Exactly. Yeah, and especially as early as you can, the more that you can do, the better that the outcomes are. And one thing that I'd like to bring up is just that physical, visceral component is critical. And if you're finding yourself really struggling with feeling motivated to go in and hold the baby or feeling motivated to go in at all, just trying to create circumstances where you can facilitate that happening. Like I remember with Elliot, we had a lovely nurse that within the first week, she had suggested that I have some kind of a burp cloth or a blankie or whatever that I held on myself when I was pumping at home. And then I'd leave it in the isolette with him. And then they'd send it home with me the next day and I could smell it while I was pumping. And just the smell back and forth between he and I, it was just something that was very passive, didn't involve a lot of actual touch between Elliot and I, but it facilitated that connection between he and I. And it's incredible the research that's coming out that supports that actually creates this bond. I mean, it's really amazing the things that are coming out about this type of thing. So the more that you can almost go through the motions of being able to be there with them, physically present in the moment, the emotional stuff will follow suit. It's kind of like you want to have both sides of treatment. One being that very physical, visceral presence with the baby, him or herself, and the other being finding that community with others so that you find your healing through being able to speak to your experience and feeling that it's normal, or at least that it's not criminal. To feel guilt, to feel shame, to feel anger, to feel depression, to feel grief. So in having both of those, it can really help carry a family through some of the most difficult moments.
I really applaud the hospitals that are making sure that there
Sure.
are support groups and that there are opportunities for families to interact and walk through that journey together. But I also think, it's really important to think about getting a peer mentor that is several years ahead of you, to be able to help walk with you through that experience, I think is invaluable. Thank you, Kara, so much for being here today to help us process our emotions around anticipatory grief.
Absolutely. Thank you so much for having me. Happy to be here.
I hope this knowledge will help parents better understand and process their emotions, because we know that in order for NICU babies to thrive after discharge, they need smart, informed parents who understand their needs and are emotionally and physically capable of caring for a medically fragile child. Peer-to-peer support is an effective tool for helping parents navigate their NICU stay. Support from a caring and informed NICU graduate parent helps a new family feel more capable, confident, and ready to face the journey ahead. To request support, volunteer, or donate, please visit our website at handtohold.org. Our quote to remember today is from C. Joybell C. Don't be afraid of your fears. They're not there to scare you. They're there to let you know that something is worth it. This episode of Hand to Hold's NICU Now podcast is sponsored by Prolacta Bioscience, the pioneer in providing 100% donor milk-based nutrition for premature infants in the NICU. Only Prolacta offers a human milk fortifier made exclusively from 100% donor milk. For more information, visit prolacta.com.